Sampling is very important to improve the validity of your study. There are many methods to do sampling, namely the simple random sampling, the systematic sampling, the stratified sampling, cluster or quota sampling, convenience sampling, judgment sampling, and snowball sampling. First, let's look at the simple random sampling. This is the most random kind of sampling done for any group. Basically, you just pick people out of random and it is quite effective. However, you may get errors as to one group may over dominate or one group may be completely underrepresented in your sample, and that could happen by random, so we have no control over it. So to overcome this, we also try the systematic sampling, which is you take every third patient or every sixth patient and then you directly take them into your groups. The next technique would be to do stratified sampling. Say for example, you want to have 5 males, 5 females, 5 children in your study. You could subgroup them into males, females and children and then take 2 in each and do your own sampling or do your study on. Next is a cluster or quota sampling. It's similar to the stratified sampling in that before it was about male, female or some parameter like that. Here it would be a geographic location. You could try Tamil Nadu, Andhra Pradesh or any other state in India, and each state would you would take a sample of 5 or 10 people from there and call that the Pan India survey or something like that. So the next kind of sampling is called the convenience sampling. The judgment sampling and snowball sampling are all types of convenience sampling. Here what happens is that the researcher chooses the subjects by convenience. For example, if it's a very rare disease, you just pick up whatever patients you get and you use their referrals to carry on with your study. For example, if 2 people are treated with a new drug in cancer and they know 2 friends who also are suffering from cancer and they want to come and try this drug, you involve them into the study. This is called snowball sampling. If you have multiple patients and you want to have a very selective group of patients or selective level of the disease to be treated, then you can do a judgment and a convenience based sampling, and that would be called a judgment sampling. So the only problem with these sampling is that it's very easy to do, but however it is prone to bias of the researcher. If the researcher's got an innate bias to avoid one group of people, then obviously that would show in their research as well. So with that, we can conclude on sampling. Thank you.